How are TB nodules seen on a CORT scan? Imagine looking inside the lungs with a special camera that gives a detailed picture of tiny structures. That's what a computed tomography scan does, and it's very useful for spotting tuberculosis nodules. On a CORT scan, tuberculosis nodules usually appear as small, round, well-defined spots in the lungs. These spots, called tuberculomas, can be as small as half a centimeter or as large as 4 centimeters. They often have sharp edges, making them easy to distinguish from other lung features. Sometimes, these nodules are solitary, meaning just one, but more often they are multiple. A key feature to look for is calcification, which shows up as bright spots within the nodule. Calcification suggests the lesion is old or healed. Around these larger nodules, you might see smaller satellite nodules or tiny spots called micronodules. These smaller nodules often cluster around the main lesion and indicate ongoing inflammation or infection activity. In cases where tuberculosis is actively affecting the lungs, the CORT scan can reveal additional signs. One common feature is the presence of tiny nodules called centrilobular micronodules, which are just 1 to 3 millimeters in size. These often appear along the small airways and are associated with a pattern called tree and bud. This pattern looks like budding branches and indicates that the infection is spreading through the small airways. Another hallmark of active tuberculosis is the formation of cavities. These are hollow spaces within the lung tissue caused by tissue destruction and necrosis, often seen in reactivation TB. These cavities tend to have thick or irregular walls. The scan may also show patchy or lobular areas of lung consolidation, which means parts of the lung are filled with inflammatory cells and fluid. These are usually located in the upper parts of the lungs or the upper segments of the lower lobes. In more widespread or disseminated forms of tuberculosis, such as miliary TB, the CORT scan can reveal a diffuse pattern of tiny nodules scattered throughout both lungs. These micronodules give the lungs a speckled appearance and are evenly distributed. The combination of these features helps doctors distinguish TB from other lung diseases like cancer or metastasis. For example, the presence of satellite micronodules around a larger nodule and the characteristic tree and bud patterns strongly suggest tuberculosis. Sometimes, tuberculomas can show increased activity on PET scans, but specific tracers are used to help tell them apart from tumors. In summary, tuberculosis nodules on a CORT scan are seen as round, well-defined spots that may be solitary or multiple, often with calcification. Surrounding these nodules are smaller satellite nodules or micronodules indicating active infection. The tree and bud pattern shows infection spreading through the airways, while cavities and patchy consolidations point to reactivation or more advanced disease. In miliary TB, tiny nodules are spread throughout the lungs, creating a diffuse pattern. These imaging features, combined with clinical symptoms and lab tests, help healthcare providers accurately diagnose TB and decide on the best treatment plan. Always remember, interpreting these scans requires a trained medical professional, and if you suspect TB, consult a healthcare provider for personalized advice.